Hey everyone. So I wanted to jump on and talk about something a little different tonight. Most of the time I talk about aromatherapy and essential oils, but if you don't know, I do a whole lot more than that. I'm actually studying to get my degree in herbalism also. And we were just studying stimulant herbs this week. And I realized as I was studying that there was so much that I was having people come to me for in the past month. And it's kind of that time of year, the weather gets colder and people who have arthritis and things like that, it kind of flares up. And then there's, the group of people that I know who, like me, eat a little too much this time of year. So we have tummy issues. And then I have a group of pregnant friends and clients who, ask a lot of questions about what they can take safely during their pregnancy for nausea and pain and things like that. So I thought I would just really quickly cover some things that I found were very important. The first herb we're going to talk about is cayenne. Okay, so like whole cayenne peppers, right? These are great. Everybody knows the cayenne pepper. These are dried. Cayenne peppers can be used internally or topically as a stimulant first for your circulatory system. So they're great to help with regulating blood pressure, and also for they enlarge veins, capillaries, and arteries, so you can have better blood flow and you can detox on a cellular level by taking the cayenne pepper internally. Using it topically is great for pain conditions like arthritis, so rheumatoid arthritis, osteoarthritis, maybe just overworked joints from exercising or your occupation. So you can make actually like a salve out of the cayenne pepper and apply that. And what happens is when you apply it to your joints that are affected, it helps to push the uric acid and calcifications that have formed in the joint and around the tissue or the surrounding tissue out, and helps to kind of flush that, and in turn decreases inflammation and helps with your joint pain. So cayenne pepper is a really great herb. It's warming, so it's really nice for that type of joint pain, and for this time of year as it gets chillier and you get stiff. Like I just noticed that I feel like my joints are stiffer this time of year. So that's cayenne pepper. The next thing I'm going to talk about is ginger root. Okay, so organic ginger root, we all have seen the large ginger root, right? And it's kind of juicy and it's hard to see here, but this is dried ginger root, and I just got it all over my keyboard. And ginger is really great for your digestive system. It's great for lots of things. It is really good for your cardiovascular system also, but we're going to talk about two things with ginger. Your digestive system, what it does is it helps to calm your tummy down, but so it's good for nausea, right? So we all know we can use I also use ginger essential oil sometimes for tummy stuff. The big thing that people are kind of torn about is ginger in pregnancy. Okay, so does it work? Is it effective? Absolutely, it totally is. It helps to calm the tummy. I mean, it just does. Whether you're pregnant or not pregnant, it works. However, there is some controversy and some studies done that ginger used during pregnancy in the first 12 weeks is actually not the wisest choice for morning sickness, because it has the effects on your body that can cause abortion or spontaneous abortion. So basically it can cause miscarriage, and it can also alter and mess with the sex hormones of your developing fetus. So it's recommended not to overuse ginger in the first trimester of pregnancy. Now, does that mean not to use it at all? No, it just means you want to use it safely and effectively in a decent dose that doesn't but I'm trying to find the dosage here. I'm sorry. but that doesn't exceed, I believe it's a 1 to 3% formula. Yes, a baseline rate of 1 to 3%. So if you take it just like any other medication or herb or oil that you're going to use, if you use it responsibly and you're smart about it, and you're not sitting there putting ginger essential oil in your water several times a day, or you're not drinking 12 cups of ginger tea, you're going to be fine. If you have some nausea and you sip on a cup of ginger tea, you're going to be fine. I mean, that is not going to be the worst thing for you. Of course, if you notice anything different during that time, any spotting or bleeding, you're going to want to back off and talk to your physician about that. So also, this is another great thing I found out about ginger root. It's great for vertigo. So it helps with people who have vertigo, and it also helps with the nausea. So vertigo is kind of like this dizzy feeling you get, you have, and it kind of doesn't go away. When that happens, you get nauseous. So what the ginger does is kind of help reduce the symptoms of vertigo, and then helps with the nausea. So that is a really great thing. It's also good for migraine headaches. Taking 500 milligrams of ginger at the onset of a migraine, and then every 4 hours, take up to 1.5 to 2 grams per day for 3 to 4 days. That is a good dosage of ginger to help with migraines. I have had so many people come to me lately who have migraines. It's also great for your winter immune booster. You can throw it in some tea with some other herbs to help keep your immune system strong. It's also great for menstrual cramps. So it is a stimulant herb, and when you mix it with some other things, it'll help you with your cycles. So the third one I want to talk about is peppermint. Okay, peppermint is wonderful. We all know it for digestion. It works great. I use peppermint essential oil for allergies, and it's actually proven in studies to help with allergic rhinitis, which is the kind of your nasal symptoms, which is fantastic. Digestive system, we all know that that it helps with the nausea and things like that. It helps with gas, burping, all that type of thing. One thing I learned that I loved, and I actually had a client who talked to me about this yesterday, is for IBS, irritable bowel syndrome. Peppermint is wonderful to take for IBS. So you're going to, it says to take it in enteric-coated capsules. So I guess I would put the essential oil in a capsule with some carrier oil and take the capsules that way, because you want it to go through the upper GI tract into the lower GI tract. So that is a really great thing, because I know a lot of people who suffer from IBS. Now, clearly we need to talk about diet for people who suffer with that also, just from a holistic standpoint, but definitely add some peppermint tea, peppermint oil. Those are going to be great things to use. So anyway, there's a little bit on stimulant herbs. I hope you guys learned a lot. Or a little, whatever. But I just wanted to share a little bit with you. All right, I hope you guys have a great night. I'll talk to you soon.